This video lecture is intended for use in PSY 101 General Psychology at Jefferson College. Students should read the accompanying textbook chapter using the provided learning guides to begin note-taking prior to viewing the video. The video lecture should then be used to enrich notes and the encoding of information. This video goes along with Chapter 15, the treatment of psychological disorders, in your textbook. We will be covering the Insight Therapies in this video. The following learning objectives from your learning guide will be covered in the video on Insight Therapies. There are three types of psychotherapy: insight, behavior, and biomedical. We will be focusing on the insight or talk therapies. The insight therapies refer to therapies in which a client or patient talks with a therapist, and through this talking and sharing of thoughts and emotions, the solution to the individual's problem is discovered. We will be going through the details of 4 different types of insight therapy: psychoanalysis, client-centered, group, and family therapy. We begin with psychoanalysis. Psychoanalysis is a type of insight therapy proposed by Dr. Sigmund Freud. As we discussed earlier, Dr. Freud was a psychiatrist or a medical doctor, not a psychologist, and he had a psychodynamic theory. This theory said that problems related to personality were due to unconscious, unresolved conflicts. As a result, his type of therapy, called psychoanalysis, has a goal to discover the unresolved unconscious conflicts. According to Freud, each one of us has intrapsychic conflict or unconscious conflict that goes on between the id, the ego, and the superego. As we discussed in class, Freud proposed that this conflict often had a sexual nature. If you remember, we talked about the psychosexual stages of development when we discussed personality. Freud would suggest that our anxiety dealt with some sort of unresolved sexual conflict from our childhood. This unconscious conflict produces anxiety, and in order for the conscious, rational self, the ego, to deal with this unconscious conflict, we engage in defense mechanisms. These were also discussed in Chapter 11 on personality. Because we engage in these defense mechanisms, it makes discovering these unconscious conflicts quite difficult. As a result, Dr. Freud proposed a number of techniques designed to get at the unconscious conflict. His first technique was called free association. With free association, he would create a climate with an individual patient where they would simply say whatever first came into their mind. So with free association, the patient was instructed to keep talking and keep talking and keep talking and allow the conscious to flow freely. Over time, Freud found that the more comfortable the patient became, the less guarded and defensive they were, the more likely they were to slip out small clues about their unconscious conflict. The therapist's job was to listen carefully to the free association, looking for themes and clues to the unconscious conflict. Another technique that Freud tried to use to delve into the unconscious was dream analysis. He theorized that while you were sleeping, the unconscious conflicts would be played out in your dreams. However, these unconscious conflicts would oftentimes be masked in symbolism. So you wouldn't have a dream that directly told you what your problem was, and your therapist would have to interpret the clues in your dream. People in psychoanalysis are frequently asked to keep dream diaries or journals and discuss their dreams with their therapist. These techniques are all designed for the therapist to analyze the patient to determine what the source of the unconscious conflict is. During the course of psychotherapy, Freud and other psychoanalysts observed a couple of issues that they actually use as a part of therapy. One of these issues is referred to as transference. What Freud found was that sometimes patients would begin to respond to their therapist in ways that played out these unconscious conflicts. So, for example, if a patient became angry with Freud, Freud would conclude that the patient was not truly angry with him, but was expressing anger most likely towards a parent or some figure from their childhood. Interpretation and resistance has to do with how the therapist reveals what the unconscious conflict is to the patient. The patient is unaware of this conflict, and if the therapist tells them directly what the problem is, they're likely to not be able to accept that. Particularly when you think of Freud's ideas about what the problem was. For example, if Freud thought the problem had to do with how the child was breastfed or potty trained or some sort of sexual attraction to a parent, a lot of people would have a problem with that. So Freud found that the interpretation process had to be done slowly over time, and that when a patient expressed resistance to the interpretation, oh, no, it's not that, it can't be that, Freud would usually take this as a sign that they had hit on a hot button issue. It's similar to the Shakespearean idea of methinks he doth protest too much. So the more people protest against the interpretation, the more validity, because defensiveness is a sign that you're getting close to the true problem. So psychodynamic therapies have several key distinctive features. They usually focus on emotions, and patients are encouraged to talk about and think about and explore their emotions. Anytime they feel anxious or distressed or upset, they are asked to probe what triggered that for clues as to the conflict that triggered the defensive mechanism. The therapist helps the client or patient find recurring themes or patterns in their thoughts, feelings, or relationships. The focus is on discussing past events and past experiences, analyzing relationships and what the themes are in their relationships with others. There's also a focus on the therapeutic relationship as an example or model of their relationships with others. And again, patients are encouraged to explore and share their deepest desires, wishes, their dreams, their daydreams, to get clues about their unconscious conflicts. Another insight therapy is called client-centered therapy. Client-centered therapy is the therapy proposed by Carl Rogers. Carl Rogers was a humanistic therapist. Humanistic therapists focused on free will, personal choice, and that people were basically good. Carl Rogers believed that we had psychological issues and personality problems if we had incongruent self-concepts. This would mean that my view of myself is not consistent with reality. As a result, the goal of client-centered therapy is to restructure the self-concept so that it better corresponds with reality. In insight-oriented therapy, Carl Rogers believed that when you received conditional love and affection from other people, that would lead to distorted shortcomings, a feeling of not being worthy of affection, a need to be somebody other than yourself in order to be loved. This would lead to that incongruent self-concept, which would lead to recurrent anxiety and the psychological problems with defensive behavior. So if the cause of the problem is conditional love, then the solution is unconditional love. As a result, client-centered therapy focuses on creating an environment of acceptance and unconditional positive regard. So when someone sees a client-centered therapist, they are not referred to as a patient. That implies a power differential. They're referred to as a client, and they are an equal partner in therapy versus psychoanalysis, where the therapist is the expert. The therapeutic climate is one of genuineness. The therapist is honest. Unconditional positive regard. The therapist is accepting. And empathy. With empathy, the therapist will validate and recognize a client's feelings. They don't have to feel the same feeling, but they understand that that feeling the client is experiencing is a valid one. Client-centered therapy focuses on not directing the therapy session, but allowing the client to choose what to talk about and where the therapy session goes. The therapist essentially functions as a human mirror using a process called clarification, where they try to get the client to talk through their own problem and clarify their problem for themselves in the process of clarifying the problem for the therapist. So the therapist does a lot of nonverbal encouragement to talk, lots of open-ended questions, lots of summing things up and asking if I've gotten it right to try to see if the therapist and the patient are both on the same page. Another form of insight therapy is group therapy. In group therapy, there is simultaneous treatment of several clients in a group. Now, this isn't a cheap way of getting individual therapy. It's a completely unique way of getting therapy. The role the therapist plays in group therapy varies by their theoretical orientation. If they are a psychoanalysis therapist, then they would screen participants for diversity. They would facilitate a therapeutic process that would allow the play out of transference relationships in the group to help reveal unconscious conflict. If the therapist is a client-centered therapist, then they would focus on screening participants for similarity and shared issues and problems. And they would facilitate the therapeutic process by encouraging each member of the group to learn to provide unconditional positive regard, acceptance, genuineness, and empathy, and essentially function as one another's therapists. This lecture will be continued in Insight Therapies Part 2.